Hello, everyone. I'm Klaus Grimm, a PA, coach, and co-host of the Transforming Healthcare Coaching podcast. And this week's podcast episode will be released a little differently. Instead of our usual Monday episode, we'll be sharing it on Saturday, March 14th, as part of the Podcasthon, a global initiative where podcasts dedicate an episode to highlight a nonprofit that they believe in. And for the second year in a row, we are honored to support the Dr. Lorna Breen Foundation, an organization working to reduce burnout of healthcare professionals and safeguard their well-being and job satisfaction. Their vision is a world where seeking mental health services is universally seen as a sign of strength for healthcare professionals. And in this episode, my co-host, Lianne Liang Emlet, interviews Corey Feist, CEO and co-founder of the foundation, about the work that they're doing to advocate for clinician well-being and systemic changes in healthcare. Take a listen to the sneak peek, and if you're curious to hear more, you can also check out last year's conversation with their CMO, Dr. Stephanie Simmons, while you wait for this full episode to drop. Learn more in the show notes from wherever you listen to us from, and we'll see you on Saturday.
The conversation, however, has been changing and needs to continue to change to one where we make the system work for the workforce and not vice versa. And so in order to make the system work for the workforce, we have to get at the root cause of these issues. And those are systemic causes. So if you were to create a scale that has individual support programs on one side and system solutions on the other side, right now the scale would be heavily imbalanced towards individual support solutions. We need to rebalance the scales, focusing on the root cause of the issues as well as providing individual support. And that comprehensive approach is where we really need to continue to accelerate in our next 5+ years at the Lorna Breen Foundation and across the healthcare industry.
I love how you really highlight the two sides. And again, it's not a either or solution. An organization and the system needs both. You need to have leaders who believe in the well-being and rethink the mindset of how they design the work groups and the cultures and the departments and the divisions, and each building has its own culture. Thanks so much for listening. If you found value in today's episode, please subscribe and share with a colleague who would benefit. Together, we can transform healthcare one person at a time. Find us anywhere you find your podcasts. Ready to take your healthcare leadership journey to the next level? Book a discovery call free at transforminghealthcarecoaching.com to explore our personalized coaching packages designed specifically for healthcare professionals like you.